Dr. Mehmet Oz just walked in the room. We waved, and he came to sit down with us here at
works
Bloomberg.
here.
Well, hold on, did not wave. I got dragged with a hook. I was trying to watch my daughter.
You see how I tried to make that? He had no idea that we were going to do this.
Not quite as innocent as you think.
Well, you know, we saw each other, we ran at each other and embraced. It's great to see you in Los Angeles. You're, of course, very, very much at home here. And I know that you're here, as you mentioned, to see your daughter on a panel. But there's a conversation at Milken that is right down the middle for you, and that's affordability in healthcare. It's something that we've heard a lot of executives talk about as they try to get their arms around this. And it's a solution that a lot of folks are waiting for. I know it's something that you're talking about right now at the White House. It's this K-shaped economy that we're in. This is one of the first areas where you can make a difference.
And we are making a difference. The reality of healthcare affordability is unlike other problems, like you can't afford the eggs, you get upset, you know, the car costs more than you want, you get mad at the dealer usually. But when you can't afford health care, that destroys the basic covenant you have with America. You own a piece of the rock. That means you get to be on the playing field. If you're not healthy, then, well, that's not happening. And especially if your family is compromised. So I'll give you a couple stats just to blow your mind for folks who may not realize how difficult it is for a lot of Americans. 1 in 3 Americans, after they see their doctor, get a prescription, go to the pharmacy, cannot fill it. 1 in 3. Now, part of the reason for that is we pay 3 times more, at least we were, 3 times more for drugs made, even in this country, bottled here, than Europeans were paying for those exact same products. So some of the most common drugs we're using in America, like the weight loss drugs, the fertility drugs, you know, basic drugs we use for fundamental recovery of health, unaffordable to many Americans. So
this is why Trump RX, right?
TrumpRx.gov, which, by the way, if you haven't heard of it, please, TrumpRx.gov. Before you buy a medication, at least check the price that's on TrumpRx.gov. Don't think of it like a discount site, although the prices are dramatically lower because they've been negotiated to be most favored nation pricing. But make sure that it's a transparency site for you. At least we demystify what drugs should cost you. And we are continuing to add drugs. We had an Oval Office event last week adding the 17th of the 17 drugs of the biggest of the 17 companies that the president wanted us to add. These are all the largest companies in the world, and so we're making huge progress there. The affordability issues also, however, touch on fraud. And part of the reason I've been spending some time in Los Angeles of late is that 1 in 3 hospices in the entire country, remember, hospice is where you go to die with dignity. 1 in 3 in the entire country are here in Los Angeles, not California. Los Angeles. Look around. People aren't that sick. They're not all dying in Los Angeles. When you see those kinds of variances in utilization, you start to suspect fraud. And in fact, that's exactly what's happening. We've shut down over 400 of these hospices in this country. When I say shut down, we suspended payments. So we're not giving them anything. And so far from the first batch, people aren't complaining. Which means they sort of know they were getting caught. And when you see this process existing without some type of enforcement or integrity of the system, reinforcing the need to be able to run it correctly, it encourages corruption. And so you see more and more doctors selling their souls, literally their licenses, to be able to falsely claim people are about to die. You see business folks, like the quick story, guy made a fortune, again, using this hospice loophole in California, and he was building a massive house with all his money, and the guy who's the carpenter remarked that he was in the hospice business. Then the plumber overheard the conversation and said, hey, me too. So literally, the contractors and the person buying and building the house, everyone's in the business. Because it's become so easy to defraud the government. We're stopping that.
Dr. Oz, there's fraud, and then there's a lot of great doctors out there and a lot of great healthcare providers. And I got to say, I talk with real Americans every day who are saying that the rollback in Obamacare, I mean, their healthcare costs are going up exponentially. I mean, that is problematic. I thought the whole goal was to reduce the cost of health care.
Well, I'm going to push back on you for a second. So we had 23 million people on Obamacare last year. Historically, it was about 12 million people. So it's almost doubled. But most of the people that were asking about these issues aren't quite as upset as you claim, because the average person went from being 82% subsidized, right? That's what they are now. And then how much did they lose? They used to be 87% subsidized. So what happened in Obamacare is a massive push to enroll people. But if you don't ask people to even put $1 up for Obamacare, you end up with a lot of fraudulent enrolled people. So I'll give you some numbers. Of the 23 million people, almost half never filed a claim. So let me ask you, if you have health insurance, you once in a while use it. If you never file a claim, you should be asking yourself, well, what happened? Why do I even have this insurance? And it turns out many people didn't even know they had coverage. Look at the numbers right now. We went from 23 million to 22 million.
I guess,
We didn't lose a lot of people.
I would beg to differ, and I would also say I'm a little concerned about administration policies and how we're going to retire in America in terms of Medicare and so on and so forth. Like I do worry about that.
Medicare is healthier than it's ever been because of program integrity. If you shut hospice down so they don't defraud billions of dollars out of the system, I'll give you a number that's going to make this very clear. It doubles the life expectancy of the Medicare Trust Fund. Doubles it. So anyone out there working their tail off who thinks Medicare is going to be there for me when I retire, if you know it's going to last twice as long, you feel good about it. And we're not doing anything. We're not touching Medicare in any way. The president has been very clear. He loves and cherishes Medicare. It will remain exactly as you know it, but it's going to last longer because we're taking the fraud out. And I think I'm going to shock you with this. The president saved Medicaid with some of these actions because we were looking at $5.4 trillion more dollars to be poured into basically legalized money laundering that would have bankrupted the system. So what we have done is put these programs on firm footing so they will continue to survive for the rest of our lifetimes.
I hope so.